exertion and orthopnea for the last few days and pedal edema. X-ray shows cardiomegaly and pleural effusion, and ECG showed a poor voltage graph on the surface ECG. And that's what the echocardiography showed. You see the left ventricular hypertrophy, some hypertrophy of the right ventricle. You see interatrial septum also thickened. You see the right anterior atrium wall is thickened, and that's seen because there is a pericardial effusion. So there is a thickening of the wall of the right atrium, left ventricle, and the interatrial septum. With a large LA and RA gives a very strong suspicion of a cardiac amyloidosis. And this is a 4-chamber view and a 2-chamber view and a 3-chamber view to get strain imaging. And on LVGLS, we can see there is a strain is markedly reduced. It's 9 against the ejection fraction, which is borderline 40%. So there is an apical sparing. You can see a cherry on the top. You can see the apical segment showing a good strain pattern, while the basal segments and the mid segments have a reduced global longitudinal strain. And this is what we call as relative apical sparing. And then we have a septal to apical ratio. You divide the ejection fraction by the global longitudinal strain. In case more than 4, in this case it is specific for cardiac amyloidosis. Now, left atrial strain pattern, you see the left atrium is hardly contracting, and the strain pattern, if you see the reservoir strain is markedly reduced, just 3%. It's as if the left atrium is not contracting at all, and reservoir strain less than 20 is quite good to differentiate left ventricle hypertrophy of hypertension from cardiac amyloidosis. You see the right ventricular strain, and there is an apical sparing of the right ventricular strain also, and this has been used in a couple of studies to differentiate between various types of strain, whether it's an AL type or ATTR type of amyloidosis. If you have a sparing, it goes in favor of light chain amyloidosis. Then this patient had an AL type of amyloidosis. The lambda light chains were markedly elevated in the blood, and the kappa was almost normal, and